A group of Canadians who have been quietly marginalized for decades has some new hope tonight. Victims of the drug thalidomide are asking the federal government for compensation. And as Ross Lord reports, they're optimistic the government may finally be listening.
Jane Rogerson isn't looking for sympathy, but the fact is her life is hard.
My arms are only about 6 inches long. I only have 3 fingers on each hand, no thumbs. Everything is more difficult. Getting dressed, cleaning the house, transportation.
Jane was born with birth defects because her pregnant mother took thalidomide to prevent morning sickness. The drug was banned in 1962, but not before devastating thousands of families around the world.
When she took it was in that period of time when the other countries had already taken it off the market. So my disability could have been totally prevented if the government had acted when the other countries did.
Depending on someone else for groceries and other essentials, Jane also spends about $300 a month on health insurance for joint pain medication. She doesn't drive because a specially adapted car costs an extra $25,000.
Things that I would like to have, like a front-loading washing machine or a stove that has buttons on the front so I don't have to lean over the hot burners. And these things cost more.
Jane and almost 100 other thalidomide survivors are asking the federal government for compensation, $100,000 a year each, to bring it in line with support from other countries like the United Kingdom. More than payments from drug companies and the government made decades ago. After renewed media coverage and pressure from the opposition, the Harper government now says it's open to suggestions.
Mr. Speaker, of course the government will support the motion, and the government looks forward to sitting down with these victims and working with them on their care needs.
Jane Rogerson is surprised at the government's sudden attention, but she's hopeful good news will emerge from meetings beginning next week between the government and thalidomide survivors. Ross Lord, Global News, Halifax.